Hello, welcome to my presentation. My student number is U3258222, and I hope you enjoy this presentation. Ivabradine is prescribed for heart conditions that involve regulating the heart rate. It functions by lowering the heart rate through the targeted blocking of an ion channel in the heart known as the current. Hyperpolarization activated cyclic nucleotide gated HCN channel blockers function by reducing the heart rate. This allows the heart to efficiently pump a volume of blood, with each beat effectively circulating it throughout the body. Mechanism of action. Ivabradine is a medication that works by targeting an ion current called the sinoatrial SA node, which is responsible for regulating the heart's natural pacemaker. This medication inhibits a channel in the HCN family, leading to a phase of relaxation in the SA node. As a result, the heart rate decreases because the SA node fires at a pace. It's important to note that Ivabradine's effects are limited to the SA node and do not impact blood pressure, cardiac conduction, myocardial contractility, or ventricular repolarization. Let's have a look at pharmacokinetics of Ivabradine. The absorption of the dose is administered orally, mainly by tablets. Bioavailability is 40%. Dosing range from 0.5 mg to 24 mg. Food delays the absorption by approximately 1 hour and increase plasma exposure by 20% to 40%. Distribution. Distribution in the body of the dose is 70% plasma protein bound. Volume of distribution 100 L. Ivabradine has distribution of 2 hours and effective 6 hours. Metabolism. Metabolized in liver and intestines by cytochrome P450, CYP3A4 enzyme. Potent inhibitors of CYP3A4 affects plasma concentrations of Ivabradine and metabolite is N-desmethyl-ivabradine, S18982, circulates the concentration by 40%. Elimination. The renal clearance is 4.2 L/hour and 4% of an oral dose is excreted unchanged in urine. Ivabradine has the ability to decrease heart rate in a way that's proportional to the dosage, and the extent of this reduction varies based on an individual's heart rate. Whether someone is at rest or exercising, the recommended doses lead to a decrease of 10 beats per minute, BPM. As the dosage increases, up to 15-20 mg taken, the heart rate reduction follows a nearly linear pattern, but it tends to stabilize at higher doses. Ivabradine does not negatively impact the heart's pumping function, inotropic effects. It may lengthen the uncorrected QT interval, but it does not prolong the corrected QT, QTC, interval when heart rate is slowed. Interdisciplinary team. Ivabradine is a Schedule IV medication, which means a prescription is needed by professional or authorized prescriber to make it legal and valid document for the pharmacist to give the medication. Here are some professional or authorized prescribers: cardiologist, nurse practitioners, physician assistant, physical/respiratory therapist, and many more. It's requirement for the person to seek counseling when or whilst being on a medication, as many information is misleading or loss of communication. These are some key points that needs to be communicated. Purpose of medication is to lower heart rate in conditions as heart failure and improve cardiac function. Heart rate monitoring. Monitor heart rate regularly. Effectiveness is often measured by heart rate. Missed dose. Advise patients what needs to be done, and should take next scheduled dose as usual, avoiding double dose as a makeup. Pregnancy and breastfeeding. Risks, benefits and other contraindication are needed to be discussed, as it not suitable for all pregnant or breastfeeding women. And potential side effects, visual disturbances, bradycardia or atrial fibrillation. Let's test your knowledge.